And the very last question goes to Paulina Alcazar from Encadena News.
Okay, thank you for taking my question. Greetings from Cancun, Mexico. As Dr. Tedros says, this virus is very quick. And thanks to the contact tracing, we know that more and more people are infected without symptoms, the so-called asymptomatics. Can this be due to taking more than 4 months in raising their immune system throughout food, vitamins, care? Do you know, do you have new records of this condition?
If I understand the question, it's more about why are we seeing more of these asymptomatic cases through the contact tracing, and are they doing something differently? We do know that through contact tracing and people who are under medical observation, some of them are being tested and they're testing positive and they don't have symptoms. And we've known this for quite some time, that you can have people that test positive that don't have symptoms. And we know that those individuals, if they're not in quarantine, they can pass the virus to someone else. What we tend to see through surveillance activities is normally surveillance is focused on people who show up in a health facility, especially in the beginning of an outbreak, certainly in the beginning of the pandemic. We often found people who were symptomatic first. And then when we did our contact tracing, if we found that that individual passed to someone else, they tended to, the secondary transmission, those individuals tended to have more mild infection, some of them being asymptomatic. We don't know why in terms of their immune system or if they were had anything to do with how they ate. What we know is that all people are susceptible to this virus and people can get infected. And we know that it's very important when we do our case finding and our contact tracing that those initial cases are isolated and they're cared for depending on the severity of their illness, and those people who are undergoing contact tracing are in quarantine. Because in essence, if they in fact are infected, then they are not able to pass that virus to someone else.
We don't know whether that is related to dose, related to age, related to the health of the immune system. But I think regardless of that, I think it's important that as human beings, we're a very complex biologic system. And we need a healthy immune system. We go through many infectious diseases throughout our lifetimes. And therefore, a healthy immune system, a healthy microbiome, having general health is very important in fighting disease. And therefore, while it doesn't specifically help for COVID-19, a healthy diet and being in generally healthy condition and protecting and promoting immune health is very positive for any number of infectious diseases. So I think it is important. Good nutrition leads to better immune systems.